This past 4 months in the Trust have been an extraordinary time for us as health and social care providers and as individuals. There have been many new and difficult experiences since the start of the COVID-19 pandemic here in Northern Ireland and since our first inpatient death on the 18th of March. We've seen tremendous spirit and cooperation within the workforce right across the Trust, and we thank each and every one of you for that, for the hard work, commitment and over and above contribution from everyone during this period. Myself as Lead Director for Infection Prevention and Control and the Medical Director want to now make another request of you all.
Social distancing is a term we've all become familiar with in this pandemic. I suppose as a people it's not something that previously came natural to us or as individuals working within health and social care. We need to ensure that this is happening across all areas of the Trust to keep us all safe. Face-to-face conversations with colleagues or anyone in work are regular occurrences. Our desire is generally to maintain confidentiality, and these therefore need to be close conversations of less than 1 metre apart. In these circumstances, in the ward or other clinical environments where such conversations occur, where it is not possible to maintain social distancing, that is 2 metres or more, we need to make sure that we take other adequate precautions. For example, when we are checking controlled drugs, you should wear a fluid shield surgical mask to protect each other. This is very important for us to help stop the spread of COVID-19. In the wider work environment, for example in the main hospital corridors or stairwells, it's important that you maintain a minimum of 2 metres social distancing. You should actively be conscious of this at all times. When you're walking in the main hospital corridors, you should always keep to the left and follow the signs. When you're walking to the main car park at the end of a shift, again you must maintain these social distance of 2 metres and don't let your guard down. This is important to keep all of us safe. The next time you're in a queue for the shop, count your steps to the next marker so that you can maintain your own proper social distancing. If you have someone who's too close to you, please remind them and ask them to step back. It is important that we all keep our social distance. Where it is not possible to keep a social distance in the hospital setting, you should consider wearing a mask.
Finally, I want to update you about contact tracing. The Public Health Agency has confirmed that staff cases of COVID-19 are to be followed up in the same way as the public through test and trace. This guidance has been applied within the SET with the joint working of Occupational Health and the Infection Prevention and Control teams. Any staff member who is tested for COVID-19 and is told the result is positive will be contacted by PHA for contact tracing outside of the workplace. They will also be contacted by the Trust Occupational Health Service about any possible contacts in the workplace. This means for all of us that if you have a face-to-face conversation within 1 metre for any length of time with a work colleague who tests positive for COVID-19 and you have had a conversation with them within their infectious period, then you could be asked to isolate for 14 days at home. This has been the case for a number of staff recently, so it is important for those of you who line manage staff that this is highlighted to them and that we support and remind each other that this is an essential control measure for COVID-19 right now. So, keep your distance at 2 metres from everyone unless you're in a clinical environment and wearing a fluid shield surgical mask.